Hello, everyone, and thanks for joining today's webinar. I'm Lior Tal, Campaign Director at Unrig Our Economy. Republicans in Congress promised to lower costs, but instead they cut our healthcare and made life even more expensive for working families. They voted to cut Medicaid and enhance ACA tax credits and put hospitals and community healthcare centers at risk, all while protecting tax breaks for billionaires and big corporations. The result is higher premiums, less access to care, and more families being forced to choose between paying for health insurance and paying for other basic needs. And now Republicans in Congress want to cut healthcare even more to pay for this unnecessary and expensive war that they've started, which is already driving up costs for working families. That's why we are excited to launch Stop Taking Our Healthcare, which is a nationwide campaign fighting back against Republican efforts to rip healthcare coverage away from working families. We're encouraging everyone on today's call to visit stoptakingourhealthcare.org, and that's stoptakingourhealthcare.org, one more time, to sign up to host an event in the month of April, or find an event in your community so that we can tell Republicans to stop attacking the healthcare coverage that we rely on. Today, you're going to hear from Congresswoman Lauren Underwood, Congressman Greg Casar, and from Americans living through the real-world consequences of these Republican cuts to our healthcare. To kick us off today, I am honored to welcome Representative Lauren Underwood, who proudly represents Illinois' 14th Congressional District. Congressman Underwood is a nurse and one of the strongest voices in Congress in protecting affordable health care and standing up for working families. She's also the original author of the legislation that created the enhanced premium tax credits that helped millions of Americans afford health insurance, which congressional Republicans allowed to expire in January. She's been clear, crystal clear, about what's at stake as Republicans move to gut health care, end ACA tax credits, and raise costs on families who are already being stretched thin. So without further ado, Congresswoman Underwood, I'll turn this over to you.
Well, thanks, Lior. And hi, everybody. Good afternoon. Thank you so much for joining us. And a big thank you to Unrig Our Economy and Social Security Works for not only bringing us together today, but for organizing this incredible campaign during such a critical moment. For those of you who I haven't met, I am Congresswoman Lauren Underwood. I am a registered nurse, and I have the honor of representing Illinois' 14th District in Congress. Last week, we celebrated 16 years since President Obama signed the Affordable Care Act into law. I was so proud to spend my 20s working to implement the ACA because this law has been transformative for healthcare in America. The ACA has made sure that people like me with pre-existing conditions could no longer be denied care. The ACA created a pathway to affordable coverage for millions of Americans through Medicaid expansion, and it strengthened consumer protections so that people can actually use the coverage that they pay for. Women are no longer charged higher premiums just for being women, and Americans have access to preventive services like cancer screenings, vaccines, and annual checkups without being price gouged. Healthcare is a human right, and in the wealthiest, most powerful nation in the world, high-quality care should be available and affordable to every person who needs it. Now, before the Affordable Care Act became law, nearly 50 million Americans were going without healthcare coverage. And in the years since, the number of uninsured Americans has fallen year after year. That number began plummeting in 2021 when my legislation, the first expansion of the Affordable Care Act, the Healthcare Affordability Act, was signed into law by President Biden as part of the American Rescue Plan. My legislation expanded the tax credits available to working families who enrolled in marketplace plans. We made them more generous and available to more Americans, and it's a strategy that worked. The rate of uninsured Americans reached record lows, and 24 million people got their coverage through the marketplace in 2025. These are more than just numbers on a page. Each one is a family who no longer is one illness away from medical bankruptcy, a child with asthma who can see their pediatrician, a father going through cancer treatment who can focus on getting better instead of only focusing on paying the bills, a sister who doesn't need to pick up extra shifts to be able to afford her brother's insulin. That is the progress that Democrats have fought so hard for so long now to protect. Because for 16 years, Republicans have attacked and worked to undermine the Affordable Care Act and affordable health care for working people. Last year, they shut down the government instead of taking action to extend the tax credits from my legislation. Donald Trump has ignored this crisis, telling Republicans in Congress not to, quote, waste time on extending them. So today, our healthcare is now facing its greatest threat. Donald Trump and Republicans' failure to address these tax credits has created a healthcare crisis for working families. The Centers for Medicare and Medicaid Services just released their report on marketplace enrollment on Monday. And for the first time in 4 years, the uninsured rate is rising. Healthcare costs have skyrocketed for families as more of them find themselves unable to afford care, and more of them are going to lose their coverage. In a new poll, a majority of people enrolled in marketplace plans are reporting that they now have to cut back on food and other basics to be able to afford their health care. Donald Trump and Republicans' failure to extend these tax credits means that for millions of families, the math simply does not work anymore. When premiums go up and help disappears, families are forced to make impossible choices. Do they keep their health insurance or do they pay their rent? Do they refill their prescriptions or do they buy groceries? And unfortunately, this is the devastating and unacceptable reality for millions of families, and it does not have to be this way. Every day, the Trump administration is spending at least $1 billion of taxpayer money in Iran. It's a ridiculous price tag for a war that Americans do not want. And it's funding that should be going to things that people do want, like extending the ACA tax credits that have made healthcare more affordable. And to the Republicans who are floating even more healthcare cuts to pay for this war, my message is simple. House Democrats will fight it, and you will fail. The American people do not want this war. They want affordable health care. We've done incredible work to expand access to affordable health care for the American people, and I refuse to give up now. These tax credits can be extended today, and every negotiation that we have in Washington is an opportunity to bring them back. Expanding healthcare coverage saves lives, and the choice before us is clear. For the sake of families across the country, we must protect and strengthen the progress that we've made, not tear it down. Thank you all so much for your advocacy. Stay engaged, keep working, and good luck with this campaign. Thank you.
Thank you, Congresswoman Underwood, for your remarks and for being one of the biggest champions for affordable health care. Next, we're grateful to share a special video and message from Congressman Greg Casar from Texas's 35th Congressional District, a leading voice and also champion for working people in this fight.
Hey y'all, it's Congressman Greg Casar, and I'm so glad you're rallying with my brilliant colleague, Congresswoman Lauren Underwood. We have to come together to protect our health care from the Trump administration. Look, they've already gutted Medicaid, the Affordable Care Act, kicking 15 million Americans potentially off of their health care. And now they want to kick off hundreds of thousands more everyday working families from their health care to pay for Trump's completely unnecessary war of choice in Iran. We've got to stop it. And the only way we do that is by making sure everyone in the public knows about it. We've got to put everyday Americans' lives above more and more profits for the Trump administration and their rich friends.
Congressman Casar couldn't be here with us live, but we're so grateful to him for joining us in this fight and for his leadership on this important issue. I'll now hand the call over to our next speaker, John Bauman, who many of you know simply as Bowser. John is a senior advisor for Social Security Works and a champion for seniors and working families who understands what's at stake when Republicans in Congress raise healthcare costs and make life harder for families who are already struggling to get by. So, John, thank you for being here, and the floor is yours.
Thanks, Leora, and I'm so happy to be here with Congresswoman Lauren Underwood. whose campaign I went to in 2018, my busiest year of going coast to coast, more than coast to coast, from Alaska to South Florida and northern Maine to Southern California, to try to help elect leaders who were going to be with us on these critical issues. And what a pleasure it was to find in the center of the country, in Illinois, this congresswoman who was a nurse and really understood healthcare issues and has proved to be one of the greatest champions for healthcare in the entire United States Congress. I just feel great about being in there on the ground floor with Congresswoman Lauren Underwood, one of the best that there is. That year I went to 57 campaigns to try to elect leaders who are going to be good on these issues. And sadly, in Congress, we have quite a few people who aren't that good on these issues. And our campaign in this month of action is designed to hold those people accountable for their vote on things like the big, ugly bill, which, as Congresswoman Underwood made clear, failed to extend the tax credits for the Affordable Care Act and cut $1 trillion out of Medicaid. And those cuts are many of those were delayed. So we're going to be feeling the effect of those cuts even more as time goes on, in the closings of rural hospitals, in the closings of nursing homes, all kinds of facilities that really depend on these funds. And the funds, of course, have been diverted to all kinds of crazy things that we are experiencing every day. Everything seems to be a distraction from the reality that they're just taking our health care. Today, the Attorney General of the United States was fired. That's going to be a big distraction from the fact that they're just taking our health care. Last night, we all sat through 19 minutes of gibberish with regard to yet another missionless war. But I do want to point out that in yesterday's news, what was way more significant than the speech last night, coming from the same individual, was something that was said in the afternoon. I'm going to read this to you because I want you to hear it. Donald Trump at an Easter lunch for families said, quote, "We're a big country. We have 50 states, all these people. We're fighting wars. It's not possible for us to take care of daycare, Medicaid, Medicare, all these things." This is a very dangerous statement that he said out loud. It's not possible to take care of Medicare, Medicaid, all these things for the federal government to do that. And, all I can say is we better be on alert, because oftentimes these things come to pass that are just sort of said casually in this administration. This reminds me of when I was in the movie Grease in 1978. And we in Sha-Na-Na sang every song in the big scene at the Hop. And remember when Danny Zuko and Cha-Cha Di Gregorio were doing the limbo? I was the guy singing the song Born to Hand Jive. And I'm the guy that somehow, being prescient in 1978, was apparently talking about what's going on in our country right now. Because I'm the guy who said, "How low can you go? How low can you go?" Say it with me. How low can you go? How low can you go? And yeah, that's kind of funny, but there's really nothing that funny about this, because I'm not sure that there is an actual bottom. So our goal is to try to refocus everybody on what's really going on. And, the day to day, there's a million distractions, but our message is simple. Stop taking our healthcare. Healthcare, not warfare. Or as my alter ego Bowser might say it, bum 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 dang a dang dang a ding a dong ding. Stop taking our healthcare. And we're going to spend the month trying to get people to do just that. Thank you, Lior.
Who knew we would get a free performance? Thanks so much, John, for being here today and for talking about all the work that needs to be done. I'll hand the call over to our next speaker, Teresa Luoni, who's joining us from New Jersey. Teresa is here to share her own experience of how congressional Republican policies are making it harder for working Americans like herself to access the care that their families need. Teresa, thank you for being with us today. I'll turn it over to you.
Good afternoon, everyone. My name is Teresa Luoni, and I live in Basking Ridge, New Jersey. I'm a mom and a full-time caregiver to my 13-year-old twin boys who are both autistic and rely on Medicaid for their health care and vital support services. I know firsthand how critical these services are because for families like mine, Medicaid isn't just a program, it's how we survive. Over the past 3 years, I've had to leave 6 different jobs because the level of care that my sons require is constant and intense. We rely entirely on Medicaid, not just for doctor visits, but for the therapy, supports, and services that allow my children to live with dignity and build futures for themselves. At one point last year, both my boys came down with pneumonia. Without Medicaid, I would have had to skip several meals a week for months just to afford the doctor appointments, the x-rays, and the antibiotics. That's the kind of impossible choice no parent should ever have to make, choosing between feeding themselves or getting their children medical care. Medicaid made sure I didn't have to make that choice, and my children didn't have to wait to have medical care. That's why I'm deeply concerned about what's happening in Washington right now. Republicans in Congress, including my own representative, Tom Kean Jr., continue to fall in line behind Donald Trump instead of putting their constituents first. From where I stand, these policies prioritize wealthy donors and corporations over everyday families like mine. For more than a year now, Republicans in Washington have worked day and night to raise costs for families like mine and make it harder for us to make ends meet. And now they're doubling down, threatening even deeper cuts to Medicaid so they can pay for their war and continue handing out tax breaks to billionaires. Let's be clear, cuts to healthcare are not abstract. They have real devastating consequences. When you cut Medicaid, people lose access to care, people delay treatment, people skip medications, and yes, people die. My Congressman, Tom Kean Jr., voted for these policies that gut Medicaid. He stood by as the Affordable Care Act tax credits were allowed to expire. And he supported the very war efforts that are now being used as an excuse to push for even more healthcare cuts. At the same time, there's talk of deeper military involvement in the Middle East, putting even more lives at risk, while billionaires continue to benefit from tax breaks and rising markets. Families like mine are being asked to sacrifice everything, while those at the top continue to gain. That's not leadership. That's failure to value human life. My family isn't alone. Millions of people across this country are at risk of losing Medicaid, paying higher premiums, or being forced to go without care they need, all because some members of Congress have decided that our health care isn't as important as protecting the wealth at the top. We deserve better. We deserve leaders who understand that healthcare is not a luxury. It is a lifeline. We deserve leaders who value people over profit. And that's why I'm speaking out. And that's why I'm joining others in taking part in the Hands Off Our Healthcare campaign. This month, I'll be at a rally in Somerset County, and I hope many of you will join me, whether you're in New Jersey or from anywhere across this country. Because no matter where we live, we all have a member of Congress who probably needs to be reminded of who they're supposed to serve, and that people should have more value over profits to our government. Thank you.
Thank you, Teresa, for sharing your story, and thank you to all of our speakers for being here today. Your experience especially reminds me why this fight matters. So families don't have to make tough decisions between caring for their families or themselves and paying for their other necessary bills. Nobody, and I mean nobody, should have to be put in that position, especially while Republicans in Congress help the rich get richer and start these endless wars. To close us out, I'd like to thank everyone one more time for joining us on today's call. Your being here today helps us hold President Trump and congressional Republicans accountable for taking away our health care. And we're excited to see all the events that we can organize together this month in April. We're encouraging everyone who's joining us today to visit stoptakingourhealthcare.org to sign up to host an event or find an event in your hometown so that we can come together and tell Republicans to stop attacking the healthcare coverage that we rely on, stop attacking our families, and stop taking our healthcare away. Your voice matters, your healthcare matters. And this month, we're going to remind Republicans in Congress and President Trump that they should be lowering costs, not taking away our health care. So thank you all for joining.